Coming up on American Black Journal, we're talking about the health disparities that affect Black men. We'll tell you about an upcoming event that's going to give African American men the resources they need to take control of their health. Plus, Metro Detroit's largest used book sale is back for its 20th year. We'll have the details on this year's Bookstock. Stay where you are. American Black Journal starts right now.
From Delta faucets to Behr paint, Masco Corporation is proud to deliver products that enhance the way consumers all over the world experience and enjoy their living spaces. Masco, serving Michigan communities since 1929. Support also provided by the Cynthia and Edsel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal partners in presenting African American perspectives about our communities and in our world.
Also brought to you by Nissan Foundation and viewers like you. Thank you.
Welcome to American Black Journal. I'm Stephen Henderson. Studies have shown that African American men have a lower average life expectancy and higher rates of chronic diseases than white men do. Multiple factors are, of course, to blame, including socioeconomic status, access to healthcare, and genetics. The Wayne State University School of Medicine is partnering with local community leaders to hold a symposium that will address these health disparities on April 13th at Hartford Memorial Baptist Church. The event is called Brother, Let's Talk, a conversation on Black men's health. I spoke with three people who were involved with the forum: entrepreneur and philanthropist Colin Mays, Dr. Harold Neighbors, who's professor emeritus at the University of Michigan School of Public Health, and Dr. Philip Levy, who's professor of emergency medicine at Wayne State. So Colin, I'm going to start with you, this idea that we need to talk. I love the title, right? And we absolutely need to talk. This is something that we don't talk enough about. This is something that a lot of us don't know, I think, enough about. And there are some real psychological barriers, I think, to getting a lot of us in a different mindset about focusing on health. Tell me about pulling this symposium together.
Absolutely, Stephen. Again, thank you so much for the opportunity to come on American Black Journal again. Such a pleasure to be here with you. Brother, let's talk. Let's talk about health. It's going to take place on Saturday, April the 13th at the historic Hartford Memorial Baptist Church in the city of Detroit. This conversation is, as you mentioned, something that is well needed in the Black community. Black men are at greater risk of hypertension, premature death, and even just emotional stress that we're carrying. And Dr. Neighbors will be able to touch upon that as well. But the importance of this symposium is that it's a safe space. Of course, the church has always been a safe space in the Black community, and it's going to be a safe space for us to not only have dialogue around some of the challenges that we might be facing, from employment to family to relationships, et cetera, but also to really talk about some of the physical challenges that we have when it comes to making sure that we're going out and exercising, making sure that we're eating that apple or that other piece of fruit daily, and that we're just being as healthy as we possibly can be for longer lives.
Yeah, and Colin, this is a very personal issue for you as well. Talk about your health journey.
Yes, so I've lost 200 pounds over the course of 3.5 years, and actually have a book coming out in April to discuss that as well. But you know, my role in life, my life mission is to encourage other Black men to really reclaim our health and make sure that we're living the best lives that we possibly can. They always say health is wealth, and I certainly believe that to be the case. So my journey was really just more so understanding that, hey, I have to be around long enough to raise kids, to be part of my family, and really just give back to my community. So for me, losing 200 pounds was certainly nothing that could happen overnight, but really was a catalyst for me wanting to promote this. And heart disease runs in my family, unfortunately. So this is very near and dear to my heart.
Yeah. So, I mean, I want to pause there because you said that like you were just noting what the weather is outside, but you lost 200 pounds. That's an incredible number. And I think for a lot of people, they hear something like that and they think, well, I could never do that, right? That has to have been some sort of heroic effort on his part. But there are a lot of folks who need to drop a few pounds. I have at various times in my life been a little heavier than I am now and had to do it. So talk about what you did to get to that incredible goal.
Sure, and I know that Dr. Levy and Dr. Neighbors will also discuss this a bit, but a lot of it was the behavior a component, making sure that I'm changing kind of my behavior around food. I used to wake up and just think about where am I going to go eat to eat. Like that was the first thing I was thinking about. But then I altered my behavior to encompass more so what can I do holistically to nourish my body? What can I do holistically to ensure that I'm putting in the right amount of food and the proper food and water, water, water. I can't stress that enough.
Yeah.
We have got to drink more water. I drink probably 1.5 gallons a day
Wow.
of water, but it's important in eliminating some of the things that we can easily get rid of, like pop, soda. I've never been a drinker, but even limiting alcohol will certainly be a great impact. And fasting. Fasting was huge for me, making sure that I'm going 14 to 15 hours of resetting my body.
Yeah. So Dr. Neighbors, Dr. Levy, you have two different kind of approaches to this subject, and I want to get to both of them. I think they're both kind of critically important to understanding how this affects folks in our community, in the African American community. So I'm going to start with you, Dr. Neighbors, and talking about the kind of cultural and societal pressures that define this problem and lead to it, and in many ways stop us from dealing with it.
Yeah, thank you. There are lots of pressures on us as Black men. I think I'm going to leave a lot of the big ticket societal pressures to Dr. Levy because I know he's been studying that very intensely in the Detroit area. I've done that kind of work myself as well and support him 100% in what he's doing. I think the way I want to talk to you today is, first of all, I have the most gray hair of anybody up here, so that makes me the senior citizen of the group. And I will tell you that I was born in 1953, and that makes me 71 years old. And like Colin, I want to talk about this from my own personal journey. I've got 3 chronic diseases chasing me, trying to take me out: hypertension, type 2 diabetes, and chronic kidney disease.
Wow.
And I won't go into all the details about those. But what I want to let everyone know is that in addition to making the kind of decisions that Colin made to lose weight, and by the way, I think I've probably lost 200 pounds over the course of my lifetime, but I may have gained 198 of them back. So, one of the lessons to take from Colin's journey is the persistence of it.
Yeah.
We can all lose weight, but we've got to stay with that healthy lifestyle that Colin pointed out in order to keep the weight off and stay healthy. So I'm a big fan of behavior as well. I will say that I'm a doctor, but I didn't go to med school. Let's put it like that. So I have a PhD. I do research. And I've done research on Black men and depression, Black men and diabetes, and now I'm looking at life expectancy. And so I just find it unacceptable and unnecessary that Black men live sicker and die younger.
Yeah.
So the reason we all have to come together and talk is because this is a crisis. This isn't an emergency. we have to change, and we have to change immediately. So, as we go through this conversation, my emphasis is on, fun, food, and fellowship.
Hmm.
We can have fun by working out.
Mhm.
And all I mean by that is going for a walk.
Mhm.
We've got to eat real food, what I call real food. And that means staying away from some of the food that tastes good, but it's not really good for us. And again,
Mhm.
that's what Colin did. And then, of
Mhm.
course, fellowship. My research shows that one of the worst things can happen to men, period, but especially Black men, is to feel like we are alone and socially isolated.
That
So that's
isolation.
why it's always about, brother, let's talk.
Yeah.
The not so good news is that we don't like to talk about this subject. We as men, we just don't talk enough about it.
That's a great segue to Dr. Levy and talking about the role that not just that medicine plays in this issue, but the way in which the relationship between African American men and the medical community affects this thing. I mean, this whole thing about not wanting to go to the doctor, not wanting to do the things that the doctor says, hey, I got to have you do this so that you'll be healthier. I mean, that is a huge part of what is off here.
Yeah, I couldn't agree more, Stephen. And thanks to Dr. Neighbors and to Colin for sharing their stories. I think the one thing you'll pick out from both of their stories is that it starts with the person themselves, right? Change behavior. You have to be motivated to do something different than you were doing, the day before or the week before. And just to put some things in context. So when you look at heart disease, which is my focus, and actually should be all of our focus areas, because it's the number one cause of death in this country, and by far the number one cause of death in the city of Detroit. So Detroiters, compared to the rest of the country, are almost twice as likely to die of heart disease. And when you look at that heart disease death, who it's occurring in, it's not 85-year-old people, it's 55-year-old folks, right? It's younger individuals. So my career has been as an emergency physician working at Detroit Receiving Hospital for more than 20 years. When the pandemic hit and we started to see brown and Black communities suffering disproportionately, we stepped back and said, why is that? It's not because COVID had a predilection for the color of someone's skin. It's because it revealed all of what we're talking about, the failure of individuals to take control of things like hypertension, diabetes, cholesterol. And basically what we saw is that people were dying from COVID because their bodies had changed over time from these conditions. And the body just couldn't handle the additional stress, the physiologic stress that COVID, bore onto the human being, right? And so I think you know about this. Others, hopefully the viewers on here do. We created a mobile health outreach to make it as easy as possible to bring care into communities, to make things place-based, barrier-free, access enhanced, to facilitate when people are ready to make that decision. Just come on out to a neighborhood resource. It doesn't have to be a day off of work. It doesn't have to be a monumental task to go get your blood pressure checked, to get your lab work done, to make sure if we identify abnormalities through that process, that people are doing what they need to do to take control of their own destiny. And we know from working with the payers in the area, about 40 to 50% of people who have insurance don't utilize prevention services that are readily available. Yeah. This isn't a problem of uninsured, right? This is a problem of people just maybe having some distrust with the medical system, because let's be honest, again, I've been working in Detroit Receiving for a long time. The system doesn't always rise up when it needs to and make Black men and women feel valued and take care of them the way they should. But when you look at who's disproportionately impacted, it's Black men, right? And so that's why this conversation is so important. And what we're bringing together here, Colin with his story, Dr. Neighbors with all the research and information that he brings to bear, and what I bring. We're bringing resources on site to this event that people can get free testing. Come out, get your blood pressure checked for free, get your lab work done for free. And we have models of care now that we're developing that don't require you necessarily to go to the doctor. Not that doctors aren't involved, but you can get a lot of this done right in your neighborhood. Yeah. Get your stuff measured. Community health workers are available to help with the social needs that are available. Pharmacists are there to help get you the prescriptions that you need. It doesn't have to be hard. We just got to take the first step.
The used book and media sale known as Bookstock is celebrating 20 years of supporting the need to read. The massive event takes place April 7th through the 14th at Laurel Park Place in Livonia. Nearly 400,000 gently used books, DVDs, CDs, books on tape, and vinyl records are going to be on sale at deep bargain prices. Proceeds benefit literacy and education projects in Detroit and the Tri-County area. And there is an essay contest called the Bookstock B.E.S.T Awards for fourth graders in the Detroit Public Schools Community District. I had a chance to speak with the district's deputy superintendent and Bookstock's honorary chancellor, Alicia Merriweather, and one of last year's contest finalists, Vicarian D.K. Merriquay, and his teacher at Davison Elementary School, Kenya Austin Posey. So Alicia, I'm going to start with you. This is a really great event every year. It's a wonderful way for people to enjoy literature and media and all those kind of things. But as important, it's a great way to support the idea of literacy and the celebration of words and ideas in our public schools. Talk to us about it.
I think it's incredibly important to celebrate reading and writing. Bookstock allows our students to participate in a contest. So they talk about their favorite book character, which means they had to read a book and select a character.
Yeah.
And then they need to write about it in a convincing way because their work is judged and then a winner is selected. So I think the piece around students reading and writing and about us celebrating students reading and writing is really important. And Bookstock has been a great partner in this for several years now.
Yeah. Kenya, we've talked before about how this plays out in the school and in the classroom. This idea of lighting kids' imagination, right, with books and stories. This is a great opportunity to do it.
Yes, it is. The students, like I said, every year they're excited to come to my class, so they know they're going to compete in this competition. And it's pretty fun. The kids get to enjoy reading the books, writing their essays. That's a total whole process because it's a lot of reading on my part, but they do a lot of peer editing as well, so they can help each other out.
Right.
But the reward is when they get to see their classmates, whoever wins or whoever gets notified that they've received an award, that's like highlighted, and we have it on our Davison 4.0. We use Teams to display our announcements in the morning.
Yeah.
So like today, they had Vicarian on showing that he will be highlighted on your broadcast today. So he's excited. Yeah.
That's funny. Vicarian, I want to hear from you especially. Tell me about the book that you read and the character that you wrote about.
Well,
Speak up.
it was really interesting to read the book
Yeah.
because I'm really fascinated in the military and
Mhm.
how the military and how history worked back then.
Mhm.
So when I wrote my essay or read the book, it was really fun to make the essay.
Mhm. Take a deep breath.
Yeah.
Take your time.
It was really fun.
Mhm. And
It was really fun to learn about how a dog saved people back in World War One.
Uh-huh. So what was the name of the book that you read?
The name of the book was Sergeant Stubby the Dog Hero.
Mm-hmm.
A hero in World War One.
Mhm.
And how did you pick that book?
I read it off of Mayan.
Yeah.
That was a digitalized reading source we used in the district. So that was last year when he
Yeah.
picked that book.
Yeah. So, Kenya, hearing him talk about that reminds me of the times in school when the teacher would say something like, hey, go pick a book off the shelf or off of this list, and we're going to do this thing with it. And the way you would kind of just look at every title and sometimes at the picture on the cover of the book and try to find inspiration. And it was that connection between the reading and your imagination, the reading and your sense of adventure that made me into a reader. I mean, it's the thing that made me keep coming back to that shelf.
That's the goal, to
Yeah.
keep picking up a book and reading. That's definitely the goal. And just to have a love and passion for it. We do weekly reading logs, so that's a requirement in our classroom.
Yeah, yeah. Alicia, Bookstock's been around a long time now. It is a rather large event. It does, of course, this piece with the public schools and with reading, but it does so much more.
Bookstock, in addition to the fact that you can have access to thousands, hundreds of thousands of books and vinyl. They've added vinyl recently, so books, records. So the sale itself, so you can get all these materials at low cost. So that's a benefit to the community in and of itself. But beyond that, and our contest that we do with Bookstock, Bookstock also supports within the district several literacy related projects. So they have supported in the past City Year, I think Beyond Basics, some other literacy interventions, and that is also helpful. So it's not just about the writing contest that we're referencing earlier, and that's coming up again soon. We'll have new winners this year, but it's also about access to books at a reasonable cost. And I think that is actually one of the greatest community benefits. Books are expensive, and especially for people that have limited resources, the idea of building a home library can be pretty daunting on a limited income. And so when you go to Bookstock with $20, you literally could come home with 20 books, and that does not happen at a regular store. So I always encourage people to build their own library or build a library for a child they know. Stock a little free library. And for our teachers this year, we've received a grant that we'll be giving out to specific teachers and schools where they can take their class to Bookstock, and they'll be getting Bookstock bucks. So thanks to the generosity of a grant. So that's coming soon. You guys are first to hear that. That is coming out shortly. So
you know, the other thing about Bookstock is I just kind of imagine that the books themselves are getting new lives, right? Somebody buys a book, they read it, maybe they give it to their children and they enjoy it. And then you can take it to Bookstock and it can do that all over again with another family. It's a way to kind of keep that word and that idea alive. It's not just the people, it's the books themselves that are being celebrated.
Can we, Dakario wanted to show you guys a book he created with his
my goodness. Yeah. We want to see that.
So this is your book he created. You want to tell him about it?
This is my book. The essay actually inspired me to make my own book.
Wow.
So here it is. It's called A Samurai from Detroit. It's about a Black samurai who becomes the most powerful samurai in the world.
That is something. My goodness. Kenya, that's like the best moment, right?
Feel it, right?
It inspires the student to go and make his own book. You must see this over and over though in the class.
I know. I was so excited. He's the first to bring me his own published book.
Is that right?
Yes. I was like, oh my goodness. So I'm wanting him to read it because it's reading month. So they're going to broadcast the different children that are reading books to the school on the broadcast. I'm trying to convince him to read for us this month.
Yeah, that's very cool. Maybe you will grow up to be an author,
right.
Dakarian. That's an early start on a really good career. Alicia, the other thing I always want to do with Bookstock is remind people, get there early, because this stuff goes. There's a lot of people who show up for this, and the good stuff goes really quick.
Yes, the grand opening, now I think there is a fee that you have to pay for the special early admission, which is where there is a line out the door at least an hour before we open. And that is, people come with their wagons, with their carts to come through and get as many books as they can from the first selection. After that crew comes through, there's still thousands of books that are available, but yes, I think when you come earlier in the sale window, you're more likely to find some things that you were actually looking for.
Yeah.
And what I would say though is if you don't know what you're looking for, you will find something still. Or if what you were looking for is gone, there's something else.
Something else there.
Last year, I found a huge oversized corduroy book, which is one of my favorite books when I was a little girl.
Yeah.
And I had to buy it. So that is at my house now, and I read it with my nieces and nephews. But those kinds of things are there. And the records, the books, come early, come often. You can come back more than once. And they also have an educator day where the books are half off, I think is the percentage discount. So pay attention to those dates.
Yeah. Okay. Well, Alicia, Kenya, and Dakarian, it was really great to have all of you here on American Black Journal, and we really look forward to this year's Bookstock. Thanks for being with us.
Right. Thank you all for having us.
Thank you for having us. And I look forward to hearing about more books from you, young man.
That's right. That's right. That is going to do it for us this week on American Black Journal. You can find out more about our guests at americanblackjournal.org, and you can connect with us anytime on social media. Take care, and we'll see you next time.
From Delta faucets to Behr paint, Masco Corporation is proud to deliver products that enhance the way consumers all over the world experience and enjoy their living spaces. Masco, serving Michigan communities since 1929. Support also provided by the Cynthia and Edsel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal partners in presenting African American perspectives about our communities and in our world.
Also brought to you by Nissan Foundation and viewers like you. Thank you.